Today is August 23rd, 2022. This is my head to toe video for fall 2022. Scanning all areas. We'll start by inspecting the skin of the head, face, neck, anterior and posterior chest. Skin is warm, dry, and intact. The color is normal for ethnicity. The texture and turgor are good. I don't inspect any edema, bruising, lesions, nevi, or scars. We're going to inspect that the head is normal cephalic, midline, and symmetric. We're going to palpate the head and scalp for any masses or tenderness. We're going to note any lesions or infestations. And we're also going to note hair dispersion, color, and texture. We're going to palpate the temporal arteries for any tenderness. We're going to palpate the lymph nodes for any tenderness. Pre-auricular, post-auricular, occipital, submandibular, submental, anterior, cervical, posterior cervical, and supraclavicular, as well as tonsillar. We're then going to inspect for any TMJ, if you could open and close your jaws. I don't palpate any crepitus or clicking. Then with cranial nerve 5, which is the trigeminal nerve, if you could clench your jaws. And then for the sensory portion, if you could close your eyes and say here.
Here. Here. Here.
Then we'll assess cranial nerve 7, which is the facial nerve. If you could raise your eyebrows, smile, frown, puff your cheeks, and pucker your lips. And then we move to the ears. Our ears are in good shape and in good position. We're going to palpate the pinna and trachea for any masses or tenderness. We're then going to look in the auditory canal and at the tympanic membrane for any redness or edema or discharge. In tympanic membrane should be translucent and pearly gray bilaterally. We're then going to assess cranial nerve 8, which is the auditory cranial nerve. And starting with the whisper test, if you could cover your ear and repeat after me.
4, 3, 9.
And the other ear.
7, 8, 4.
And then the Weber test. You should hear the vibrations equally bilaterally. And then Renee, tell me when you no longer hear the vibrations.
Now. 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 Now.
And the air conduction should be greater than bone conduction. We're then going to assess the brows, lashes, and palpebral fissures, as well as the sclera and conjunctiva for color, lesions, or discharge. We're going to assess cranial nerve 2, which is the optic nerve. If you cover your right eye and read the Snellen chart on the wall.
E, D, F, C, Z, P.
The other eye.
E, D, F, C, Z, P.
And then both eyes.
E, D, F, C, Z, P.
And then we'll assess central and peripheral vision. If you could cover one eye and tell me when you see my fingers.
Now.
Other eye.
Now.
And then tell me what fingers I'm holding up.
2, 1, 4.
Other eye.
2, 1, 5.
Okay. And then we'll assess cranial nerve 3, which is oculomotor. And then accommodation and convergence. If you could look at the wall and then follow the pin. Good. We'll assess for extraocular movement with cranial nerves 3, 4, and 6, which are oculomotor trochlear and abducens, if you could follow my pen light. Good. And then we're going to look at the internal structures and assess for the red light reflex with the ophthalmoscope. And the red light reflex is present bilaterally. And then we move to the nose. The nose is midline and straight. We're going to assess cranial nerve 1, which is the olfactory nerve. You smell that?
Mm-hmm.
It also verifies that our nerves are patent. We're then going to palpate the frontal maxillary sinuses for any tenderness. Then we move to the mouth. We're going to inspect the lips, gums, teeth, buccal mucosa, palate, posterior pharynx, under the tongue, salivary ducts, and the tonsils. I would grade a 0 because they've been removed. We're going to assess cranial nerves 9 and 10, which are glossopharyngeal and vagus. If you could stick your tongue out and say ah, we should see symmetrical upward movement of the uvula. And then a cranial nerve 12, if you could stick your tongue out. We don't know any fasciculations in cranial nerve 12 as the hypoglossal nerve. Now we're going to move to the neck. The trachea is midline and symmetric. We're going to palpate the thyroid gland. If you could swallow and swallow. And then palpate the carotid arteries. And then auscultate for any bruise. Then we'll move to the posterior chest. If you could turn around. We're going to inspect for any signs of respiratory distress with any tripod positioning, nasal flaring, tachypnea, cyanosis, or retractions. We're going to inspect that the back is symmetric and there's no deformities. We're also going to palpate for equal chest rise and fall. And then we'll palpate for tactile firmitus, if you could say 99.
99, 99, 99, 99, 99, 99.
And then we'll percuss in all the lung fields. In the intercostal spaces. And then we'll auscultate. Ensuring that we get the lateral lobes. We'll then auscultate for any signs of consolidation, starting with the eophony, if you could say E.
E, 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 E.
And then bronchophony, if you could say 99.
99, 99, 99, 99, 99, 99,
And then whisper pictrology, if you could whisper 99.
99, 99,
Good. And then we'll move to the anterior chest. You can turn around. We'll inspect that the chest is symmetric and there's no deformities. We'll palpate for equal chest expansion. And then palpate tactile firmitus, if you could say 99.
99, 99, 99, 99, 99, 99.
And then we'll auscultate. Then we'll move to the heart. We're going to auscultate over each valve, starting with the aortic valve, which is the second right intercostal space, the pulmonic, which is the second left intercostal space, Erb's point is fourth right, tricuspid is fourth left, And the mitral valve is the fifth left. We'll then do those again with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. We're going to locate the PMI over the mitral valve. We'll then also listen for the equipulse for a full minute. We have a rate of 70 with a regular rhythm. You can lie down. We're going to assess for any JVD or jugular pulsations with the head of the bed 30 to 45 degrees. And then we'll perform auscultation of the valves again. We'll start with aortic, second right intercostal space, pulmonic is second left, Erb's point is fourth right, tricuspid is fourth left, and the mitral valve is fifth left. We'll do that again with the bell. We're also going to inspect for any heaves or lifts, as well as palpate for any thrills over each valve. We then are going to move to the abdomen. We inspect that the abdomen is flat and symmetric. We're going to auscultate for bruits over the aorta, the renal arteries, iliac arteries, and femoral arteries with the bell. We're then going to auscultate for bowel sounds in all four quadrants. And then we will percuss in all four quadrants. We should hear tympany except over the liver and spleen. We should hear dullness. We're then going to palpate for any masses or tenderness, as well as palpate the liver and the spleen. You can sit up. Maybe you turn to the back. We're going to assess for any CVA tenderness. Okay, and you turn to the front. We'll do musculoskeletal. We start by inspecting the joints of the hands, fingers, wrists, elbows, and shoulders. I don't know any edema, erythema, nodules, or crepitus. We're going to assess capillary refill. Less than 30 seconds. Radial pulses are 2+. We're going to do range of motion of the fingers, flexion, extension, hyperextension, abduction, adduction, and thumb opposition. Range of motion of the wrist, flexion, extension, hyperextension, and rotation. And then ulnar deviation and radial deviation. Range of motion of the elbows, flexion, extension, hyperextension, range of motion of the shoulders, flexion, extension, hyperextension, adduction, abduction, adduction, internal and external rotation, and circumduction. We're going to assess hand grips, 5 out of 5. Bicep and tricep strength is 5 out of 5. Shoulder girdle is 5 out of 5. If you could show against resistance. That assesses cranial nerve 11, which is the spinal accessory nerve. We're going to note the overall skin integrity of the upper and lower extremities. The skin is warm, dry, and intact. I don't know any edema, erythema, lesions, bruising, nevi, or scars. We are going to assess the light touch sensation of the upper and lower extremities. If you close your eyes and say here when you feel me touch.
Here, 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 here.
And then we'll do the vibratory sensation over the proximal ulnar prominence, as well as over the medial malleolus. We'll then do diagnosis and dysphagia. If you would close your eyes and hold out your hand and tell me what I put in your hand.
A pen marker.
And then if you could tell me what I'm drawing on your hand.
The number 3.
Good. We'll do our cerebellar functions. If you could do finger. And then palms up. And then if you could touch your finger to your nose to my finger. Then we'll do deep tendon reflexes. Brachioradialis, bicep, tricep, brachioradialis, bicep, tricep, patellar, Achilles, and the Babinski reflex. We'll then move to range of motion. First, we're going to do capillary refill of the toes, which should be less than 3 seconds. Our dorsalis, pedis, and posterior pulses are both 2+. We'll perform range of motion of the toes. If you can scoot back a little. We'll do flexion, extension, hyperextension, abduction, adduction, range of motion of the ankle, dorsiflexion, plantar flexion, inversion, eversion, and rotation. Then if you could dorsiflex and plantar flex against resistance, it's 5 out of 5. Knee strength is 5 out of 5. And hip strength is 5 out of 5. You can stand up. We're going to do range of motion of the knees. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Then range of motion of the hips. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Abduction, adduction. Internal and external rotation. And then circumduction. And then if you could turn to the side and perform lumbar flexion. We're going to assess the spine for any curves or asymmetry. You can bend up in extension, hyperextension, lateral flexion, and then rotation. Then we're going to do range of motion of the cervical spine, flexion, extension, hyperextension, lateral flexion, and rotation. Then if you could close your eyes and hold your arms out, this is the Romberg test. We're assessing for any swaying. And then you can open your eyes and take a few steps forward and walk back heel to toe. And then if you could hop on each foot. And that concludes my head to toe.